If you see a contrast-enhancing spinal lesion in the intradural but extramedullary space, think of a meningioma, especially in older women. These tumors originate from the arachnoid cap cells and compress the spinal cord, causing an upper motor neuron lesion below the lesion like spasticity or Babinski reflex. So unlike intramedullary tumors like ependymomas, meningiomas will hug the cord, the spinal cord, from the outside. And unlike metastasizing cells, they're going to be neatly circumscribed and intensely enhancing. And so the cord is squeezed from the inside of the dura, but outside of the spinal cord, then it's going to be arachnoid in its origin, and it's going to be a meningioma. And so we'll look at and see kind of the layers here: our skin, bone, dura mater, and then our arachnoid, and then below our pia mater. So it's going to be a meningothelial or arachnoid cell tumor. And in our question stem here, so a 7-year-old woman has progressive lower limb weakness and difficulty walking. She's got some increased tone hyperreflexia, bilateral Babinski signs. MRI shows contrast enhancing at T10 in the intradural extramedullary compartment. What's the diagnosis? Meningioma. It's a slow-growing, well-defined intradural extramedullary lesion. Not ependymoma, that's going to be arising from within the spinal cord, and this is intramedullary. Metastasis usually would be in the extradural space from the vertebral body spread. Osteoblastoma is bone-derived, extradural, so you'd have a bony destruction for osteoblastoma. And your hemangioma is going to be vascular, mostly vertebral. So osteoblasts would be the bone-forming cells, the tumors that arise from them. Those guys are going to be extradural as well. And your vascular endothelial cells, these guys are involved in your hemangiomas. So that would typically occur in your extradural space, and this patient has intradural extramedullary lesions, and so it wouldn't support that conclusion. So there's a little schematic. Basically, your meningothelial arachnoid cells are going to present with that intense enhancing contrast, and they're going to form in the spinal cord located in the meninges in the intradural extramedullary space. Okay, ciao.